Welcome to Dank YouTube channel, your trusted learning platform. Kindly subscribe to the channel for more videos. To get the best from your studies, kindly order a copy of the Ultimate Guide to CBT for Adult and Mental Health Nurses, available in Ghana and UK only. 1. Patient is asking for a leave against medical advice, LAMA. The medical team has concerns about the mental capacity of the patient. What decision should be made? A. Call the police. B. Call the security. C. Let the patient go. D. Encourage the patient to wait by telling the need of treatment. Option D is the correct answer. Encourage the patient to wait by telling the need of treatment. It is important to respect the autonomy of the patient while also ensuring their safety and well-being. Explaining the need to stay opens a communication about importance of treatment. Option A and B cannot be used because it has not been established they lack capacity yet. Letting the patient to just go does not ensure their safety whilst there are concerns about their capacity. 2. A person supervising a nursing student in the clinical area is called as A. Mentor. B. Preceptor. C. Interceptor. D. Supervisor. Option A is the correct answer, mentor. A mentor is a nurse or midwife that supervises, assesses and facilitates students' learning in the practice setting. A preceptor, on the other hand, is to newly qualified nurses to support their learning or to adapt to a new job role through a preceptorship program. 3. Training of student nurses is the responsibility of A. Ward in charge. B. Senior nurses. C. Team leaders. D. All registered nurses, RNs. Option D is the correct answer, all registered nurses. You are required by the NMC Code of Conduct as nurse or midwife to support students' learning to help them develop their professional competence. 4. In supervising a student nurse to perform a drug rounds, the NMC expects you to do the following at all times. A. Supervise the entire procedure and assign the chart. B. Allow student to give drugs and sign the chart at the end of shift. C. Delegate the supervision of the student to a senior nursing assistant and ask for feedback. D. Allow the student to observe but not signing on the chart. Option A is the correct answer. Supervise the entire procedure and sign the chart. Students are to be supervised directly regarding any aspect of task they carry out. 5. You have assigned a new student to an experienced healthcare assistant to gain some knowledge in delivering patient care. The student tells you the HCA pushed patient back to the chair when she was trying to stand up. When should this be reported? A. As soon as possible after an event has happened, to provide up-to-date information about the care and condition of the patient or client. B. Every hour. C. When there are significant changes to the patient's condition. D. At the end of the shift. Option A is the correct answer. This is an act of abuse and should be reported immediately. 6. What is the minimum length of time that a student must be supervised directly or indirectly by the mentor on placement? A. 40%. B. 60%. C. Not specified, but as much as possible. D. Depends on the student capabilities. Option A is the correct answer, 0.40%. The UK NMC states that students should be supervised by their mentor for at least 40% of their time on placement. 7. A nurse educator is providing in-service education to the nursing staff regarding transcultural nursing care. A staff asks to describe the concept of acculturation. What should be the response? A. It is subjective perspective of the person's heritage and sense of belonging to a group. B. It is a group of individuals in a society that is culturally distinct and has a unique identity. C. It is a process of learning a different culture to adapt to a new or change in environment. D. It is a group that shares some of the characteristics of the larger population group of which it is a part. Option C is the correct answer. Acculturation refers to the process by which individuals or groups adopt and adapt to the cultural traits, values, beliefs and behaviors of a different culture which is a dominant one. 8. When doing your drug round at midday, you have noticed one of your patient coughing more frequently whilst being assisted by a nursing student at mealtime. What is your initial reaction in this situation? A. Tell the student to feed the patient slowly to help stop coughing. B. Ask the student to completely stop feeding. C. Ask student to allow patient some sips of water to stop coughing. D. Ask student to stop feeding and assess patient swallowing. Option D is the correct answer. Ask the student to stop feeding and assess patient swallowing. Coughing during mealtime could indicate swallowing difficulty or aspiration risk where food enters the airway instead of the esophagus. Stopping the feeding and assessing the airway is a priority to check for choking, distress, etc. 9. Which student requires a sign-off mentor? A. All consolidation students who started an NMC-approved undergraduate program which commenced after September 2007. B. Learners undertaking conversion courses. C. Students on their final placement in second year. D. Nurses, midwives undertaking mentorship preparations. Option A is the correct answer. All consolidation students who started an NMC-approved undergraduate program which commenced after September 2007. A sign-off mentor is a registered nurse or midwife who is deemed competent to assess the proficiency of student nurses and midwives. They are responsible for verifying that student has met the required standards of proficiency to enter the profession as a registered nurse or midwife. 10. To whom should you delegate a task? A. Someone who you trust. B. Someone who is competent. C. Someone who you work with regularly. D. All of the above. Option B is the correct answer. Someone who is competent. Delegation is the act of assigning tasks, responsibilities to another person. The NMC Code of Conduct requires nurses and midwives to delegate tasks to only competent or trained person. Thanks for watching and kindly subscribe for more.